I'm Erica Tellis. I'm a GEM nursing student, and I give my consent.
Come in and wash my hands. Hi, my name is Nicole. I'm going to be your nursing student today. Can I please have your name and date of birth?
Erica Tellis, 7/30/95.
Perfect. So I will be assessing you today. Anything I can do before we get started?
Nope.
Okay. How are you feeling today?
I'm very happy.
Okay, good. So the patient is smiling. Her mood matches her behavior and her affect. She's giving me eye contact. She's sitting up straight right now. I noticed that she is a female. She's sitting comfortably. Let's see. Are you in any pain at all? So if I say a scale from 0 to 10, 0 being no pain at all, 10 being the worst pain, are you in any pain?
I'm in no pain, 0.
Okay. So 0, rate that no pain at all. If she did have pain, I would assess like where the location is at, the severity, which we already kind of, if she would rate it on a scale, the timing of it, what provokes it, if it radiates anywhere, all those kind of characteristics and qualities. I know you mentioned your name and birthday earlier. Can you tell me where we are at right now?
We're in my basement.
Okay. Can you tell me the year?
2020.
Perfect. And what are we doing right now?
Head-to-toe assessment.
Okay, so the patient is alert and oriented. She, ×4, she mentioned person, place, time, and event. Okay. Then I am going to assess her speech. Her speech was articulate. It was well-mannered, smooth. Nothing out of the ordinary is expected findings for her age. And like I said, she was well-nourished and well-developed for her age. Okay, so then I am going to start with pulse. So I'm going to come through here. I'm going to assess for her radial pulse. The rhythm is regular, it's elastic, rated grade as 2+. Because it is at a regular rhythm, I will count for 30 seconds and times 2. And right afterwards, I will count her respirations without her knowing. That way, she doesn't change her breathing style or anything like that. Okay, good. So I counted 40 for 30 seconds, so times 2. So her pulse was 80 beats per minute, which falls in the normal range between 60 and 100. I counted her respiration. She was at 16, which falls in the normal range of 12 to 20. The depth was about 1 inch. It was not labored. Her nostrils or no nasal flaring. She seems to be comfortable at the moment. So now I'm going to be checking your blood pressure. First, I'm going to look at the arm. Don't see any IVs, nothing that I would contraindicate. Is there any reason why I can't check blood pressure on your right arm?
Nope.
Okay, perfect. So, do you know your usual blood pressure?
Yeah, it's 118/78 usually.
So make sure that I measure. The ladder, it's 80, 40. Good measurement for your arm. Make sure that this is in the category. 2. And just breathe in and out. Let me of you rest your hand on mine so it's at heart level. Okay, it was 118/76. So that top number falling between 90 to 120 for systolic, which is at a normal range, and then the bottom number of 76 falling between 60 and 90, which is normal range for diastolic. So put that away. Next, I will go for assessing the rest of your body now. So when just looking at the patient, her eyes are in line with the top of her ears, the nose is midline, eyebrows and eyes are both symmetric. I do not see any apparent drooping. Head is normocephalic compared to the body. Oval, it's erect. Can you do some facial movements for me? So can you raise up your eyebrows? Can you puff out your cheeks? Can you smile? Perfect. Everything is symmetrical, no drooping. Like I said, everything is even. Okay, so now let me assess for your pupils. So guys, just look straight ahead at me. Okay. Pupils are at 5, which falls between the normal range of 3 to 5 millimeters, which is expected. So now I'm going to check for constriction of your pupils. So just look directly at me, and I'm going to shine a light in your eyes. Okay. Good. Now if both of those for direct, your pupils are constricting, can you put your hand in the middle of your head? So now I'm going to check for indirect. Good. Perfect. So both pupils were constricting evenly. Now I'm going to check for accommodation. So just follow my light. So I'm going to break your nose here. Okay. Eyes are converging correctly. So recap, her pupils were equal and even. They reacted to the light with constriction of the pupils, and her eyes accommodated well with converging. Okay, so now I will check for her arm. So first off, I notice that it is light beige. There is some pink undertones, a little redness right there. Lots of freckles. These would be primary lesions. I do not see any scarring or anything abnormal. I'm going to check. Hair distribution is even. Feeling for temp with the back of my hand. Even throughout. It's warm, dry. Her fingers look well groomed. I'm going to check for capillary refill. Comes back within 2 seconds. That is a normal finding and expected. Good blood flow. Now I'm going to check for the profile of her finger. I do not see any clubbing. Okay. Now I'm going to palpate. Just let me know if you feel any pain at all while I'm doing this, especially around your joints. Any pain at all?
Nope.
Okay. I don't feel for any edematous spots. If I did, I would rate that on a 0 to 4 for a scale for pitting edema. Okay, so now I am going on to her chest assessment and thorax. So just looking at her from straight on, I can see that her sternum is midline, her clavicles are even, chest isn't barreled at all, it's at normal expenditure. It's at expected findings. So then I will check her posterior. Looking here, the patient's shoulders are even, her spine is midline, her ribs are sloping at a 45-degree angle, hips are aligned, nothing out of the ordinary. These are expected findings. So I will come back to her anterior side and I will listen for her lung sounds. So before I place this on your chest, I'll try to warm it up a little bit so it's not cold. Just take a deep breath in and out whenever I move.
Okay.
Lung sounds on the anterior side are clear, no adventitious sounds like crackling or wheezing. Her lung sounds seemed even throughout. Right here. Now I'll be checking for her posterior lung sounds. Same thing, whenever I move the stethoscope, just take a deep breath in and out for me. Same thing for her posterior lung sounds, no crackling, no wheezing, no bronchi, clear lung sounds. Now I'll come back this way. I'm going to be listening for her heart sounds. So I will describe each of the spots as I go through. So let me first feel. So, okay, the second intercostal space, the right side is the aortic, so I'll listen for that. Perfect. Heart sound is strong. Let me listen for the second intercostal space on the left side, which is pulmonic. At those two sounds, I was able to hear S2 very clearly. Let me go down to Erb's point at the third intercostal space. I try not to listen over any bone or breast tissue. Okay, at Erb's point is where I could hear any murmurs. There are no murmurs at this time. Now I will be listening for the tricuspid at the fourth intercostal space. Okay, and then the fifth intercostal space of the left side is mitral. At the tricuspid and mitral sounds is where I can hear S1 the most clear. Okay, so now that I've listened to all that, I'll have the patient lie down. Okay, so I will make sure that she is covered up. Are you feeling comfortable?
Mm-hmm.
Okay. Normally if she had a gown, I would make sure that her top portion is covered. So I will first assess for any lesions. I do see a couple moles, a slight birthmark. That is all primary lesions. Noting the color, it is even with her arms, it is light beige, pink undertones, not flushed at all. I'm going to look at for the contour. The abdomen is flat, not protuberant or extended at all. Now I'm just going to listen in all the quadrants. Do you have any pain in your abdomen?
No.
Okay, if she did have pain, I would listen to and palpate that section last. Okay. I can hear gurgles and clicks about every 5 seconds, so that would fall between the range of 5 to 30 per minute. So they're active bowel sounds, not hypoactive or hyperactive. Now, sorry, my hands are going to be cold. I'm going to be checking for your stomach and palpating in the starting from the right lower quadrant and going clockwise. No masses. The abdomen is soft and non-tender, and you said there was no pain at all during that assessment. And at this time, I would check for any like fluid spaces, looking for any additional fat, looking if the patient had a fetus at all, or if her stomach was a little distended, it might be due to flatulence or anything like that. Okay, so I will cover up here and check for her leg. So at this time, I'm going to note the color as well. Same thing, light beige, pink undertones, a little more redness around here. I do notice a bunch of freckles everywhere, which are primary lesions. I see that you have a scar, possibly from a past surgery. Is that correct?
Yes.
Okay. Patient has a secondary lesion of a incision scar on her knee. I'm going to check. Just let me know if you feel any pain at all while I'm palpating.
Okay.
Any pain at all?
Nope.
Okay. I'm going to be checking underneath. Skin looks even, feels warm and dry. No apparent wounds or openings. It does get a little colder down to the toes, which is to be expected. I'm checking for heels, nothing open. In between her toes, everything looks well groomed. Her nails look to be expected findings. They're nice and clean. Looking at her hair follicles, they are, I believe the patient shaves her legs, but they are even. Okay, that all looks good. Now I'm going to be checking for the dorsalis pedis. Okay, it's a little weaker than her radial pulse. I would grade it as a 1+. It is elastic, just a little less strong versus her radial pulse. Okay, now I'll check for her posterior tibial pulse. Same thing, just a little weaker than the radial pulse. I would rate it as a 1+. It's even and elastic. Okay, now I'm going to be checking for bilateral flexion of dorsal flexion and plantar flexion. When I ask you, or when I put my hands underneath your feet, I'm just going to have you push down for me like a gas pedal.
Okay.
Perfect. And then I'm going to have pull up towards your nose. Good. So the patient feels strong. It's even. Don't notice any differences between both legs. Up here. Actually, one last thing too. Do you feel any numbness and tingling in your legs?
No, I do not.
Okay. If I felt for any numbness and tingling, I would make sure that I know where it starts from, where it ends, where it originally is located at. And I would also note that she doesn't have any edema. Same thing, if there was any edema, I would rate it from a 0 to 4 on that pitting scale. Okay. Then lastly, I'll just make sure the patient is comfortable. While she's laying there, I would check to see if I see any other interventions, like if she had a Foley, if she has an IV, which we stated that she doesn't. The patient is on room air, so no oxygen, any other devices like that. Make sure that the bed is at lowest position, your items and call light are in reach, side rails are up. Anything else I can do for you?
No, I'm all good.
Okay, that'll be it.